Hello everybody, welcome to another presentation of the kind of routine specialist dentistry that my team and I here at London Dental Specialists carry out regularly. If you like these videos, please subscribe to our YouTube channel or follow us at London Dental Specialists on both Instagram and Facebook. So let's get into today's case. It is of a 28-year-old gentleman who was referred to see me by a colleague up in Scotland, and the patient's main concern was sensitivity to hot, cold, and sweet. So let's have a good look. So this blue line on this photograph represents the position of the gum line when those teeth originally came through, and you can immediately see that there has been gum recession here and there has been gum recession there. So let's go into why gum recession ultimately happens. There are two main reasons. One is gum disease, the other, put simply, is aggressive toothbrushing. So let me show you how to identify each one of those two causes. The key is to notice these triangles of gum between teeth. They are called the interdental papillae, and I'm just going to shade them in for you. If they are there, then the reason for your gum recession is aggressive toothbrushing. If they are not there, then the reason is more gum disease than aggressive toothbrushing. And so the other thing to also think about is, what are the factors that make us more likely to get gum disease? And they are a history of braces or Invisalign treatment, and it is therefore really, really important that when you are having this kind of treatment, which we all know is exploding at the moment, you make sure that you are dealing with a dentist or a specialist who understands the interaction between the brace type treatment and your gum. And that's why one of my associates is Dr. Kira Ennis, who is an absolutely fantastic orthodontist, and I'm a gum specialist, and together we ensure that these kinds of treatments are carried out safely. The other thing that leaves you more likely to get gum recession is if your gums are naturally thin, or if the bones, again, are naturally thin. Ultimately, what are the options in this case where there's sensitivity, there's gum recession, the patient is also concerned about the cosmetic appearance of those teeth, and the patient is concerned that the teeth are likely to fall out. I immediately said to him, highly unlikely that the teeth are going to fall out, but I accept that the cosmetic issues may be of concern to you. So the first option is just to do a filling of some description to try and deal with the sensitivity, because that was the original complaint. All right. The other option is gum graft surgery that aims to do one of two things. It either aims to cover the roots, to reposition the gum to where that blue line was originally, or to make sure the gum, or make it more difficult for the gum recession to progress. All right. The reason why I personally will always prefer the gum graft surgery over the fillings is really simple. When all dentists and all dental therapists know that the most difficult parts of the tooth to get really, really good bonding, yes, is around where that gum recession is. That is the most difficult parts of the tooth. Now, I can tell you that the success rate of gum graft surgery at 10 years or more is about 92 to 95%. So it is highly predictable. It's usually one surgery, and as long as you maintain it, that is it. Okay, it is certainly much more successful than having any kind of filling material. And in the end, if you just think about it, using a filling material to replace gum, again, for me, just doesn't make any sense. And so if we look at this photograph again, remember the presence of that interdental papilla, so this little triangle of gum, is also very important in trying to determine whether the gum graft is going to cover the roots or just prevent deterioration. If that triangle of gum is present, which it is in this case, then I will always opt to cover the roots. It's very simple, and the results look much better. But if if that triangle is not there, then the only thing that we could do is the surgical procedure that reduces the risk that significantly reduces the risk of gum recession getting worse over time. So let us have a look at the results. And here they are. This is where we started. Look at the blue line again. And here is the final result. And let's compare the area under the blue line here and here. And you can see that there has been a significant increase in the amount of gum available down here. And this is because of the gum graft surgery that we did. This was 6 months afterwards. They work and work beautifully. And as long as you maintain them the way we will tell you, that gum graft will be there for many years to come. How long does the treatment take? It took about 2 months in this case. On average, it costs about £1,200 per tooth, but the more teeth you need, the lower the price per tooth comes. And in this case, I'm sure the patient used some interest-free finance for reasons I already said. We take great pride in treating everyday people. So why not either refer yourself or speak to your dentist about sending you to me to have this kind of treatment done. Or if you are looking to have either braces or Invisalign treatment, please ensure that you get your gums checked, and you get your gums checked very carefully. And I, as a gum specialist, would be only too happy to check your gums for you. Many thanks.